Good afternoon, everyone. Thank you so much for joining Child Psychological Maltreatment Implications for Intervention, presented by Jody Todd Manley. Jody Todd Manley, Ph.D., is a licensed clinical psychologist, clinical director of Mount Hope Family Center, and research professor in the University of Rochester Psychology Department. She is on the leadership team for the Transform National Center on Child Abuse and Neglect, funded by the National Institute on Child Health and Human Development. She has had more than 40 years of experience in providing clinical services to children who have experienced trauma and their families. Jody, it is over to you.
All right, hopefully everyone can see my slides. And I do appreciate your time and attention to this topic and carving time out of your schedule to join me today. So I am coming to you from Mount Up Family Center in the University of Rochester in Rochester, New York. And I wanted to give some acknowledgement to the Fontana Center of the New York Foundling and the Psychological Maltreatment Alliance for coordinating this webinar today. So in my work at Mount Hope Family Center, I am part of, as Brittany mentioned, the Transform National Research Center, which is translational research that adapts new science for maltreatment prevention, funded by the National Institute on Child Health and Human Development. I also want to give appreciation to the Substance Abuse and Mental Health Services Administration. Mount Hope is part of the National Child Traumatic Stress Network, and in particular, our Sustaining Change project is a training and technical assistance center that's supporting some of the work today. So I'm going to give special thanks to my Psychological Maltreatment Alliance colleagues who helped with pulling together this presentation, especially Marla Broussard and Stuart Hart, who have been working tirelessly for decades to bring the issue of psychological maltreatment to elevate the awareness and the knowledge in the field, and to my collaborators, Judy Reiches from the Child Maltreatment Policy Research Center, Amy Baker and Akeem Marsh from the Fontana Center, who helped to put this together, and especially Amy Slepp and Danya Glaser, who are my co-authors on the definition and paper that I will be telling you about in a bit. So, well, my slides are not advancing. That's not a great way to start. Here we go. So today what we're going to do is start off with talking about what is psychological maltreatment and the definition that's been developed, and then looking at the consequences. Why does it matter that we understand psychological maltreatment and its impact? And then I want to focus on how we can use our understanding of psychological maltreatment to have intervention and prevention strategies. So what are the considerations and approaches that we might use for intervention? And then how can we avoid having children experiencing psychological maltreatment in the first place? And depending on our timing, if we have time at the end to do some questions and some discussion, then we'll do that at the end. I know one of the questions that always comes up, and Brittany's going to help me monitor the chat, but I know one of the questions that is always asked is whether this information will be shared, whether the slides can be shared. And I am comfortable sharing the slides, and we're also recording the presentation for archival purposes later. And one thing I want to note is that I'm going to be focusing on psychological maltreatment today. We know that there's a lot of overlap between psychological maltreatment and other forms of physical and sexual abuse and neglect. But we want to really highlight the unique features of psychological maltreatment that are distinct from those other forms of abuse and neglect. So keep that in mind. So I'm going to be primarily referencing a paper that came out in 2022 with Amy Slepp and Danya Glaser and I, looking at developing a definition of psychological maltreatment. And this has recently been incorporated into APSAC practice guidelines that are going to be released in 2025. And when we developed this definition, we included some other prior definitions and classification system, including one that I developed with my colleagues Doug Barnett and Dante Cicchetti, a maltreatment classification system, which used the term emotional maltreatment. For today, I'll be talking in terms of psychological maltreatment. And we incorporated the Heyman and Slepp FAIR system, as well as the early work of Hart and Broussard. And one of the reasons this was developed was the recognition that there's a lot of variability in state statutes, variability across jurisdictions, and we really needed a more unified operational definition to be able to elevate the understanding of the phenomenon. And so what we developed was this definition, which is that psychological maltreatment refers to caregiver behaviors toward or involving a child. Remember, this is excluding physical and sexual abuse and psychological and physical neglect. And these are behaviors that cause or have strong potential to cause serious harm to a child's emotional, cognitive, social, interpersonal, or physical well-being or development. And so it's important to see that this is the overarching umbrella for the definition. So if you are wondering whether a certain situation would qualify as psychological maltreatment, then you start with, does it fit with this definition? And after you look at that overall definition, then we want to know about whether it meets two criteria. And these include caregiver behaviors and having a significant impact on the child. So the caregiver behavior would include non-accidental acts or omissions. And then the impact on the child could be actual psychological harm or a reasonable potential for harm based on what we know about children's needs and children's development. And so that harm could include significant disruption in the child's physical, emotional, cognitive, social, or interpersonal development, or reasonable potential for that disruption. It could include significant psychological distress, which might be a psychiatric disorder at or near a diagnostic threshold, or any kind of disorder like a major depressive disorder, anxiety disorder, etc. It could include somatic symptoms that are related to stress that interfere with normal functioning, and it could include more than an inconsequential fear reaction. So what we look at is, does it meet that overarching definition? And then can we identify caregiver behaviors as well as a significant impact on the child? So if you're wondering what that might look like, there's a tremendous amount of variability in how psychological maltreatment might manifest. To look at those caregiver behaviors, there are a lot of different forms that could take. And Diana English, in her work on the long scan study, she had access to all of the CPS records across Washington state, and she identified 27 different types of psychological maltreatment. I'm going to highlight 7 major subtypes. of child psychological maltreatment with some examples. And if you'd like more details about these different forms that psychological maltreatment may take, there's more information in the Slep et al. Publication, as well as in the new updated APSAC practice guidelines that are being released soon. So one type of psychological maltreatment that we may see is psychological neglect, in which the caregiver acts consistently or unreasonably deny the child interaction or affection. And so that could include leaving the child unattended without the possibility of interaction or affection. Maybe that's leaving a young child in a crib or a playpen for a very extended period of time, being unresponsive to the child's bids for appropriate response from the caregiver, more of that egregious lack of affection. And we can get some examples of that from, for example, a memoir from an adult that was shared with me included children sitting outside their mother's bedroom, waiting for her to wake up as she was sleeping the day away, leaving small gifts for her and artwork that they drew while they were waiting for her to pay attention to them. Another memoir that suggests that the worst feeling they had as a kid was that my mother was willing to miss my life for a drink. Now, none of this definition or the examples that I will give say anything about parental intent. Often caregivers are struggling with whether it be substance use challenges or their own mental health concerns. So there may be a lot of reasons why these happen. And we will talk about that with regard to intervention a little later. A second form that psychological maltreatment may take is spurning, which is verbal and nonverbal caregiver acts that may cut down or degrade a child when the caregiver is hostile to the child. And some examples could include humiliating or insulting the child, mocking the child for having feelings or having needs. In some cases, scapegoating or blaming the child, maybe blaming the child for family problems, showing preferential treatment where one child is treated significantly worse than siblings, cruel nicknames, calling the child worthless, saying I wish you'd have never been born, I hate you, could include denigrating the child's loved ones or friends or family or pets or those different forms of rejecting the child. A third example would include developmentally inappropriate interactions where the developmental standards are inappropriate for the child's developmental level. That could include treating the child older or younger than where they are developmentally by parentifying or infantilizing the child. So maybe that includes a child who's too young is expected to make their own meals or get themselves ready independently for preschool or their childcare program in the morning. Or if the child is older and is not able to do their own developmental needs, going to school or socializing with friends because they have primary caretaking responsibilities for their younger siblings, if those expectations are inappropriate. Or it could include things like treating the child as a peer and confiding in the child about adult matters or adult relationships that are inappropriate for them to be exposed to. Another example of a form of psychological maltreatment could be inappropriate discipline, that even though it's not physically injurious, it might still have a psychological toll. And that could include things like excessive discipline that is more frequent or intense than is appropriate for the situation. It could be confining or binding a child, locking them in a closet, locking them in their room for extended periods of time. Things like compelling the child to inflict pain on themselves, placing unreasonable restrictions on their social interactions, or preventing them from accessing basic physical necessities, so keeping them from sleeping or resting, or even having access to the toilet or to water or to light, keeping them in a dark room, keeping them in a cabinet. So those are some of the examples of the inappropriate discipline. And then another form includes terrorizing the child or exposing the child to potentially traumatic experiences. That could be exposing them to violence in the home, or to parental self-harm. It could also be things where, maybe the child doesn't understand something that might be intended to be part of a joke or a prank, but the child doesn't understand that it's not real. Um, a recent thing that some of the Psychological Maltreatment Alliance colleagues have been researching recently is the use of social media and ways that children are involved in social media things that could actually be terrifying or harmful. So there's been a a scary Snapchat filter where the child's face is distorted and it looks like there's a giant spider crawling across the child's face. The child may not be able to tell that it's a filter, may really find it scary. Um, and then certainly there are other examples outside of social media where the parent may threaten to abandon the child or disown them or expel them from the home, or that there may be a threatening violence to the child or to a loved one. And even if there's a nonviolent action, it's that threat and the fear and the terror that can evoke from, even if that uh, is not followed through on. A sixth form is exploiting, which can include using the child to fulfill the caregiver's needs over the child's needs. One way that this can happen is grooming the child for sexual abuse. Even if the sexual abuse does not take place, the grooming process itself may be destructive. And some other examples include Munchausen by proxy, where the caregiver is making the child sick because they have some benefit from being the parent of a sick child. And this exploitation can include posting images of the child online to get social media attention or money, which can be also using the child for the parent's gratification or for the parent's needs, um, as opposed to what the child is needing. Sometimes children are caught up in mixed allegiances in family dynamics and are kind of a pawn in the middle of family dynamics that can be harmful to the child as well. And finally, I'll highlight failure to socialize, where the caregiver's actions encourage the child to develop inappropriate behaviors or attitudes, or they fail to appropriately socialize the child to societal expectations. And that could be encouraging alcohol or drug use, or encouraging the child or failing to prevent the child from being involved in criminal activity, maybe encouraging vandalism or shoplifting. Apparently, there's been a TikTok challenge, which is a fight prank. So encouraging the child to beat up another child, or the parents pretending that a neighbor's going to come beat them up, and the parent needs the child to take on the neighbor's child as part of a family battle. So there are a lot of different ways that psychological maltreatment different types of caregiver behavior that are examples that would fall under the overarching psychological maltreatment definition. So with that, I'm going to shift gears a little bit. Rather than talking about the forms of psychological maltreatment, I'm going to shift to the effects and looking at what we know from research on the unique consequences of psychological maltreatment. Because remembering that in addition to the caregiver behaviors, we're looking at how these behaviors may cause or have a strong potential to cause harm to the child's emotional, cognitive, social, interpersonal, or physical well-being or development. So we want to think about the effects in a comprehensive way. And so if those of you who are listening are involved in clinical practice, or you're actually in the mental health field, um, or in any kind of child serving system, thinking about what you might see. How do you see this manifest with the children that you're involved with, either providing treatment or supporting in some way? So thinking about what you might see in terms of actual harm, or what might be some of those areas that have strong potential for harm and significant disruption in the child's development. So let's talk about some of these consequences that have been shown in the research. So even recently, in the aftermath of the COVID pandemic, there was a study that came out um, that was Anderson and colleagues looking at the associations of adverse childhood experiences in the past year during the COVID pandemic. And one of the things they found was that emotional abuse was a factor that was most strongly associated with poor mental health outcomes and suicidal behavior. So I'm going to break down some of these different domains and areas where we see the impact, um, particularly in these 6 broad categories. Some of them are more internalizing difficulties like depression, suicidality, social anxiety. Some are more acting out or externalizing behavior problems. But there are also some cognitive and physical consequences as well that have been shown in the literature. So starting with depression and suicidality, some of my colleagues in Germany have published an article, Slensong, Schuster, Kiel, and White, looked at various forms of child maltreatment. They did use the maltreatment classification system, and I worked closely with them on that. And what they found was even controlling for abuse and neglect, psychological maltreatment had some of the strongest associations with internalizing behavior problems over and above abuse and neglect, especially for older youth between the ages of 9 and 16. So it is an area where we found particular associations. Another study that looked at adverse childhood experiences found that childhood emotional abuse posed some of the greatest risk for lifetime history of depressive disorders, as well as more recent depressive disorders. And a meta-analysis that looked at a number of studies of multiple forms of child maltreatment found that suicidality was more strongly linked to psychological abuse and psychological neglect, even compared with other forms of physical abuse and neglect. And another meta-analysis by Angelakis and colleagues found that emotional abuse and neglect increased the odds of suicidality as well. So there's a lot of associations between psychological maltreatment and depression and suicidality that we need to pay attention to. Another recent meta-analysis in 2023 by Liu and colleagues found that social anxiety was significantly more associated with psychological maltreatment than physical or sexual maltreatment. And more recent research is also looking at how there could be complex relationships. So there are also some mediational effects where social anxiety may mediate the relationship between emotional abuse and depression. So it's another area to pay attention to, the effect of psychological maltreatment on interpersonal relationships and social anxiety in particular. If we're looking more at conduct disorders, so delinquent behavior, there are some linkages there with psychological maltreatment. And often psychological maltreatment combined with physical abuse is a pretty common pattern. And the combination really elevates the risk of youth getting in trouble with the law, other antisocial problems like dating violence, substance use. And the German study that I mentioned earlier, that combination of emotional maltreatment and physical abuse was particularly predictive of externalizing disorders, especially among younger children. And that was accounting for variance over and above abuse and neglect. We know that there are some associations with substance abuse and co-occurring depression and anxiety that have been linked to psychological abuse, as well as some risky sexual behavior. In addition to these internalizing and externalizing problems, there are also some particular concerns around thought problems like hallucinations, dissociation, some psychotic features that have been found to be associated with psychological abuse in particular, verbal abuse and exposure to domestic violence, as well as to psychological neglect. And some of these may be part of a trauma response to maltreatment. Another area is looking at how psychological maltreatment may be related to cognitive functioning. And some of the early work that was done in Minnesota with the Minnesota longitudinal study of risk and adaptation by Eglin, Sroof, and Erickson found that psychologically unavailable parenting led to declines in cognitive development for infants and toddlers. So they had declines over time as a result of that unavailability of caregiver attention. And there's been a British birth cohort study with almost 9,000 people that followed individuals over time and looked at the ways in which psychological and physical neglect in childhood predicted problems at age 50 in memory and processing. And currently in our Transform research studies, we're following people who were involved with us in childhood. We're following them into adulthood and into the next generation with their parenting, and looking at long-term cognitive impacts of child maltreatment and finding some early deficits in that area. Another way that psychological maltreatment can have an impact is looking at physical health problems. And we need to consider the links between psychological maltreatment and somatic complaints and experiences of pain, as well as looking at physiological development and the impacts on brain development and physiological regulatory systems, inflammation, even cellular aging that's been associated. And that's another area that Transform is conducting that longitudinal research presently. So some of the findings, specifically linking psychological abuse to asthma, is well known, and Teicher and colleagues have found associations with child maltreatment on brain structure and function and connectivity. In particular, their findings highlighted how severe exposure to parental verbal abuse was associated with the thinning of gray matter in the brain in the auditory cortex, as well as changes in white matter associated with that stress, and in particular, looking at language pathways. So, taken all together, we can see that psychological maltreatment has some pretty significant consequences for physiological and psychological development. So that leads us then to what do we do with all of this knowledge? And how do we help children and families? And the starting point always begins with assessment. Any type of intervening needs to start with, where do we intervene? How can we understand what's happening? Um, where does the problem lie? What might be contributing to the psychological maltreatment? And that's going to inform where the intervention should be focused. Ideally, we want to be able to assess the needs and understand any underlying root causes. That if we can address those root causes, that may head the child and family in a more positive direction. What I'm going to be focusing primarily on is intervening during childhood and with families rather than talking about adult treatment. Certainly, adults who experience psychological maltreatment as children may benefit from trauma treatment or psychotherapy. Any treatment that's provided should be developmentally appropriate no matter when in the life course it occurs. But my focus and my experience has been primarily in working with children and youth and their families. So we're going to talk about assessment, and then I will shift to some considerations with looking at treatment and ways to intervene, whether that's supporting the parents and caregivers as the focus, supporting the children as a primary treatment target, or supporting the family systems or broader systems. But let's start with assessment. So in order to figure out how any type of support for a family could be useful, we need to really understand what's going on, not make assumptions, but to identify what are the child's needs, considering their developmental level and their different domains of functioning. How are they doing in their emotional functioning, their interpersonal skills, their physical needs, and having a good understanding of the child's needs to be able to figure out how best to meet those needs. And then what's going on with the caregivers? Who are the caregivers? Are they the biological parents? Are they alternative caregivers? And what's been the experience of those caregivers? Maybe they have their own history of experiencing psychological maltreatment or other forms of trauma. They may be experiencing oppression or intergenerational challenges. And how has that led to feelings of being overwhelmed? What resources do caregivers have available? How overloaded might they be? And with that in mind, we need to factor in parental mental health challenges, including histories of trauma or depression or anxiety or other types of mental health problems, substance use and challenges they may be struggling with that. We need to take into consideration parenting knowledge and skill. Um, Babies don't come out with a user's manuals, and most um, parents don't get education on childhood development or support around parenting skills. Often people talk about how they parent based on how they were parented, and they've learned based on what they grew up with. But often many of the parents we work with say they don't want to raise their children in the way they were raised. They want to break the cycles. They want to treat their children differently than they were treated, but they may have limitations in knowing how to do that. And it's parenting is difficult, particularly in the absence of support systems and extended family or community resources. So that can place a family at greater risk for psychological maltreatment. And then the context of the community and what challenges are going on for the family in terms of community connections and resources or lack thereof. So it's best if we can have a comprehensive assessment of all of these dimensions to really have a more informed and more comprehensive way of identifying areas for intervention. So how do we collect all that information? There are a variety of different ways, which include observing the parent and child interactions, observing the child's behavior, the environment, and that can provide some valuable information about the child's experiences and the potential that they may have experienced some psychological maltreatment or may in the future. Clinical interviewing can be very helpful to, if the child's old enough, talk with the child about their experiences. Certainly talking with the caregiver about how things are going, where do they see their needs, where do they see opportunities for support and what would be helpful to them. Sometimes reviewing records can be informative, whether that's medical records, educational records, as well as child abuse and neglect reports. And that can provide information about past experiences. Sometimes retrospective reports have challenges because people's memory may be insufficient, where some of that prospective record data can be helpful in what was collected in real time. And then it's helpful to have as much collaboration as possible. We use some transdisciplinary case conferencing in some of our work where we bring together mental health professionals, medical providers, child protective service staff, law enforcement, legal and court personnel to try and come up with a more collaborated plan, and to collect information from all of those different perspectives can be very useful. Also, with the definition as it's been laid out, with needing information both about the caregiver's behaviors as well as the child impact, that may require partnering, so that maybe child protective staff work closely with mental health professionals to do those assessments and to understand the impact on the child and the child's level of functioning. So we've been talking a lot conceptually and theoretically and from a research perspective. I'd like us to bring it into a case example to be able to think about how this may look and how this could play out. So let's imagine, if you will, that We have a child named Shane, and his kindergarten staff contact his mother, Susan, asking her to pick him up from school after a behavioral outburst. Susan was furious with Shane because she had to take time off of work to pick him up from school. And so she yells at him, "What do you think? I'm made of money? You're ruining our family. I hate you." After they get home, Susan locks herself in her bedroom and shouts through the door, "If you're acting so grown, you can fix yourself dinner. You don't need me." Shane reacts by starting to kick and pound on the door. Susan shouts, "Shut up or I'll punch your lights out." And then when his behavior continues, Susan shouts, "If you don't stop, I'm calling the police. They'll haul you away to jail." So if we can envision a scenario like this playing out, let's think first about, would this meet our definition of psychological maltreatment? And I think we could see that these are some parental actions that have the potential for causing harm. Susan's losing her cool. She's clearly emotionally dysregulated. She's under some financial stress. She seems like she's not sure how to handle his behavior and his emotions. We don't know much about what support she might have, but it seems like she could be operating with little support. And so then if we think about the different types of statements that she's making and actions, how that would fit into some of the examples of psychological maltreatment I mentioned earlier. There's some spurning that's evident with some derogatory comments, developmentally inappropriate expectations with some neglect around expecting him to meet his own needs, make his own dinner, as well as some threats. And those could be really terrifying for the child. And if we think about the impact of behaviors like this on the child's outcomes, we could see that it's very upsetting and distressing for him. And we have some evidence that he's having some problems in kindergarten with his behavior. So those could be indicative that these types of experiences of psychological maltreatment are having a negative impact on him. And so we're going to be thinking about, what types of examples we might see in families that we're working with. And then if you were working with this family in some way, what steps might you consider in terms of how best to intervene to support Shane and assist with his development and to support Susan in all of the areas that she's struggling with? And my slide is having trouble advancing. Hopefully it will cooperate. There we go. So there are some different assessment tools that we can use. There are some structured assessments like the parent-child conflict tactics scale. There's some diagnostic interviewing that we could do to look at the impact on the child. We could also assess trauma symptoms. And I'm really encouraging that we think broadly in terms of those assessment domains that we want to be looking at, and thinking about using the information that we find in our assessments to then think about how might we pick intervention focus areas and possible treatment models to help this child and family. So in doing so, we need to consider the developmental age of the child and their level of functioning, and what sorts of supports that they need that would be developmentally appropriate, because we know that signs and symptoms of psychological maltreatment can vary depending on the child's age and stages of development. We don't want to miss something because the child maybe isn't old enough to tell us what's going on or to share their experiences verbally. And psychological maltreatment can take many forms. It may be difficult to identify, especially if it's occurring alongside other forms of abuse and neglect. And so mental health professionals can really try to be aware of signs and symptoms of psychological maltreatment with these comprehensive assessment strategies. And that requires an understanding of the cultural and contextual factors as well. We have to be aware of how cultural beliefs and practices can affect assessment processes and ensure that our assessment strategies are culturally sensitive and respectful, as well as being a understanding of the broader context with regard to poverty, social isolation, parental stress, other family challenges. And that's where that collaboration can be very helpful, with partnering with people with different areas of expertise to develop a more comprehensive approach. And the approach needs to be trauma responsive and informed by what we know about reactions to trauma, and trauma treatment approaches that are evidence-based. And in developing that evidence base, who has the model been evaluated with? Who is it appropriate for? What populations can it be used most effectively with? And so with that trauma-informed approach to assessment and treatment, it's recognizing and responding to the impact of trauma on the child's mental health and well-being, and how to support the family functioning to support the child. So I'm going to bring in Bronfenbrenner's model here, looking at a transactional model of development, where we understand that children are nested within the context of their family, their community, the broader culture. And so we're looking at ways that we can assess both the risk factors at each of those levels of the ecology, as well as what are some protective factors that we could harness. What are some cultural strengths and resources that the family may be able to use to support the child and help the child develop in the most adaptive way. So that developmental process is across the life course, and we want to be mindful of all of the factors at the level of the individual child, the family, the community, and the broader culture that could either potentiate psychological maltreatment occurring or could buffer against those risks. And it's that balance of risk and protective factors that we need to pay attention to. So with all of the information that we're hoping to collect, what does that do in informing our approach to intervening with children and families? There are a lot of different approaches in treatment and in different models. Some focus on supporting the parents and caregivers. Some focus more on treating the child, and some are more family-based, but we can also look at more systems-based approaches. So I'm not providing an exhaustive list, but I want to talk about some different approaches that you might want to consider. One approach for supporting positive parenting and looking at an emphasis on parents and caregivers. One is that potential lack that I mentioned before, that parents and caregivers may not know what's developmentally appropriate. They may not understand child development. So you could implement something like Parents as Teachers, which is a home visitation model for helping caregivers understand child development and see themselves in the role of the child's first teacher. And how can we help bolster parents' understanding of developmental expectations as a way of helping them be more on target with the way that they're working with their child. There are a lot of different other parenting models, such as parent management training approaches like Incredible Years and others that help to build parent skills and help parents learn how to manage their children's behavior. Parent-child interaction therapy, or PCIT, can do some active coaching to help both understand the child's needs and support the child, and support the parenting um, while they're coaching the parent-child interactions. A different approach that Mary Dozier developed, which is called attachment and biobehavioral catch-up for young children, focuses on helping caregivers follow the child's lead and help with the parent's ability to co-regulate children's emotions. And she developed that originally with foster and resource parents, but then developed a modification of ABC for parents as well, especially for children in the first 4 years of life. They're developmentally attuned interventions to support the nurturing that children need, as well as following their lead in their behavior. And she's found some remarkable long-term outcomes of that model with not only supporting parent-child relationships, but even physiological changes as a result of that very short-term intervention. And then an alternative to more of the parent management training, behavior management approaches, teaching parenting skills around behavior management. An alternative is an emotion coaching approach. For example, tuning into kids, or the older version of tuning into teens, helps parents and caregivers look at what are the messages they learned about emotions as they were being reared and when they were growing up, and to look at what could be the ways of helping children regulate their emotions, because some of that emotional reaction and emotional functioning may be driving the behaviors that are problematic. But rather than focusing on the behaviors, what if we back it up and help children to express their emotions differently? And how to support parents in not being dismissive of children's emotions, even well-meaning, trying to help the kids be happy and redirect their attention. Sometimes that can come across as not understanding the emotions. Or sometimes parents end up actually being discouraging of emotional expression. But tuning into kids helps parents to evaluate their own understanding of emotions, and to help coach their children on regulating their emotions, and that can lead to very positive parent-child relationship outcomes. So these are all different types of interventions that focus on parents and caregivers. We could also look in a very different directions and say, what if we support family systems by looking at the resources available to families? And there's some approaches that look at more systemic changes. Can we implement something like an earned income tax credit or financial supports to relieve financial stress on families? And maybe that could lead to differences in family interactions or parent-child interactions that could reduce psychological maltreatment. Or what if we make more resources available to families, like accessible childcare or accessible medical insurance and medical care, accessible education, or even things like crisis nurseries where families could drop off their children temporarily while they're working on a stressful situation. So looking at maybe even community supports to support families, that could be another area of intervention that we might want to think about. All right, next I want to turn to some child treatment approaches. And in these child treatment approaches, I'm going to highlight two different interventions that are evidence-based trauma treatments. And I am familiar with both of these as a trainer in child parent psychotherapy, which is for children in the birth to 5 age range. It's a dyadic treatment approach with parents and children seen together in dyadic sessions. Trauma-focused cognitive behavioral therapy is a commonly implemented trauma treatment for children as young as 3, all the way through 17. And it is individual child treatment, but there are family components to that treatment. So I want to highlight, not that any of these models that I'm mentioning have a specific focus on psychological maltreatment, but there are many ways that we could think about how psychological maltreatment could be included in the way the treatment is implemented, both to treat the psychological maltreatment that may have occurred and also to prevent future problems in a preventive way. So I'm going to start with child parent psychotherapy. And I want to credit my colleagues, Chandra Ghosh-Ippen and Alicia Lieberman. Chandra Ghosh-Ippen is, I need to give her tremendous credit for developing these slides, which I'm sharing. So these are our CPP training slides that I'm going to be sharing with you to give you a flavor of how CPP would address psychological maltreatment and how that could be factored into the way we think about the trauma that might have occurred and to promote healing in the context of that parent-child relationship. So remember our vignette about Susan and Shane? Let's back that up and go back in time if we were a fly on the wall and get a better sense of where some of that behavior and some of those negative parent-child interactions may have some of their origins. So imagine Susan back when she was pregnant with Shane, when she was 19, and the baby was kicking. She's frowning and saying, "He's always kicking me. Damn it, he better stop. I'm not going to have another guy kick me around." After Shane's born, he's about 6 months old. He's crying. And Susan looks at him with anger and says in a chilling tone of voice, "You better cut it out. Nobody loves a crybaby." Then when he's 8 months old, he's playing with a soft toy. He flings it. He hits Susan in the face. And what might her reaction to that be? So the reason I'm bringing this up in this way is to think about some of the ways that psychological maltreatment may emerge from experiences and different types of interactions that caregivers may have experienced and that they may perpetuate if we're not able to find ways of breaking some of those cycles. So one way we think about how this could emerge with a CPP frame is that caregivers' past experiences in relationships can shape their current relationships, including their parenting and their approach to parenting and their ways of managing their own emotional and behavioral challenges. And think about what it might, how it might shape our understanding if we knew that when Susan was growing up, she was beaten and left by her father and her stepfather. Her mother experienced significant depression and couldn't deal with Susan, and how those experiences might shape her views of relationships. She might come to believe that men can hurt you and leave you. Other people, even your mother, can't necessarily help you. And how might that shape her parenting when she comes to have expectations about her child? She might believe that my child will hurt me, that he doesn't care about me, that I'm not important to him. And then if we look at that, the impact of those kind of beliefs and perceptions on the ways she interacts with her child, it could lead to her selectively attuning to certain behaviors that Shane exhibits that support these beliefs and experiences. So she might tune into, well, he threw a toy at me, he cries when I'm around, he doesn't care about me. And then how does Shane come to view himself? He may internalize some of these beliefs, may view himself as bad, as aggressive. He may learn that when I'm upset, people might leave me. And then, unfortunately, sometimes that can become a self fulfilling prophecy. And this is one of the ways that some of those messages that could be shared with him in a psychological maltreatment kind of a context impact his development and his behaviors. And then those behaviors just serve to reinforce um, and underscore the caregiver's beliefs and expectations. So when we're intervening to try and interrupt this cycle and change the nature of the parent-child relationship in CPP, often what comes to us when a child is referred is their behavior problems. What we know about Shane's behavior in his early infancy, he had difficulty being comforted. As he got older, he was hitting and kicking. And then by 3 years of age, he was choking a child in school. So, what we try and develop is what we call a bridge of understanding to connect these behaviors and emotions with experiences. And that's one of the mantras that we use in the National Child Traumatic Stress Network is that we it's not so much what's wrong with this person, but we want to understand what happened to this person. So we want to try and connect the feelings and behaviors with experiences. So what we find out is that in Shane's experience in the first year of life, he had exposure to domestic violence. When he was a year old, the police were called when his father was beating his mother. Mom was hospitalized. Later on, mom had a new partner who was kicking and then subsequently choking mom. So we can think about the psychological maltreatment aspect of that exposure to violence, as well as the examples of some of the statements and interactions that mom had with Shane as well. And that gives us a much better understanding if we can link those experiences with the outcomes in his behaviors and his feelings. So in CPP, we call that trying to build a bridge of understanding. And so we use that bridge of understanding also to look at mom's experiences. Well, she had her own experiences of being hit and being left in childhood, difficulty with her own anger and sadness, and that may have contributed to the way that she's responding to her child. maybe not being sensitive and understanding of his reactions, partly because of a lack of understanding of his developmental needs, but more with these interpersonal dynamics that are deep-seated and long-standing. So she may reject Shane's approach to her, may reject his need for attention and affection. And understanding those connections between past and present is part of where we use our intervention approaches. First with assessment, because we don't want to target for change what we don't yet understand. But then to think about how do we address mom's experiences and the child's experiences. So we develop what we call a triangle of explanation, where we look at that bridge of understanding and how treatment is a place where we can unpack those histories of trauma, where we can speak the unspeakable, talk about what happened, talk about the challenges. We're helping both the child and the caregiver to make those links between what they saw and heard and now how they're feeling and behaving in the context of hope that things can change for the better. And we're highlighting also the protective steps where we can build on the caregiver's strengths and build on whatever resources are available to make some changes in the sensitivity with which the child or the caregiver can meet the child's needs. And we hold that intergenerational framework. We want to know what the caregiver's been through and how that affects the way that the caregiver responds to the child and navigates the world, and how the treatment can support the caregiver to better support the child. We want to understand the historical context. Many caregivers are trying to provide their children with something better than what they received, but they may fall into those old patterns. And there may be ways that what we call the ghosts from the parents' nursery and their history of conflict in relationships may play out in a way that they don't intend to repeat the pattern, but they find themselves falling back into what's familiar. So we're supporting the caregiver so that they can support the child. And we also want to understand that larger socio-ecological context and what the caregiver and the family have been through in the broader sense of the systems and service providers, responses to certain behaviors and types of emotions, and how treatment can acknowledge historical trauma as well as the ongoing impact of relationships and functioning. So hopefully you get a little bit of an illustration from the CPP approach of how psychological maltreatment may have some deep roots. One of the approaches in CPP is to provide some unstructured developmental guidance when that could be helpful to help the caregiver understand the child's development. But if that's not sufficient, then it may require some deeper work to support the caregiver in addressing some of that past history of trauma to promote healing. And fortunately, we have a lot of research evidence to show that there can be healing and more positive interactions, including more secure attachment relationships, and even some physiological changes such as improvements in reducing cellular aging for children who've experienced trauma. So CPP was designed to treat trauma more broadly, but certainly the psychological maltreatment aspects of those traumatic experiences can be woven in throughout the treatment and can support the caregiver's ability to sensitively respond to their child's needs. So with that as an example of a trauma treatment model, I'm going to shift now into the other example that I mentioned before, and talk about trauma-focused cognitive behavioral therapy. It's a different approach to treatment, but could also be relevant for treating psychological maltreatment. So if you're familiar with TFCBT, it is a cognitive behavioral approach that uses these different components of treatment, one of which is parenting skills. It is treating the child individually, but the parenting work and support for the parenting skills runs throughout the treatment. So that could take a number of different forms. In some cases, parents have experienced their own trauma. So the child may be referred after exposure to intimate partner violence. And in that situation, the child has the impact of that violence exposure, and the parent was victimized by that violence as well. So it could include needing to support them. And what we know in TFCBT outcome research is that parent or guardian involvement is essential to address the child's behavioral and emotional difficulties. The rule of thumb is involving the current caregiver. So it's a short-term treatment model. So whoever is caring for the child during that period of time. But the evidence suggests that the parent can be the child's strongest source of healing, the parent or caregiver. So whoever that adult is who's in the child's life can be a tremendous resource for supporting the child's healing. And so the model does emphasize positive parenting skills and enhancing enjoyable parent-child interactions. And that parent support is a very strong predictor of positive treatment outcomes. It can be challenging for a number of reasons in the aftermath of trauma. Some parents may have an inappropriate level of self-blame or guilt as a result of what happened to their child, or in some cases, they may blame the child for what happened. So those issues would need to be addressed. Sometimes the parenting skills come out as overprotectiveness, where parents are really trying to restrict any potential exposure of future trauma, but they may inadvertently be over restrictive and not let the child do what is developmentally appropriate with interacting with other people. In other cases, parents are overly permissive because they feel like the kid has already been through so much, that they take a very laissez-faire approach that doesn't provide the child with the supports and the structure that they need. And as I mentioned, the parent may be struggling with their own PTSD symptoms. And similarly to what I discussed earlier, the caregivers may have their own challenges with regard to their history of trauma that can affect their parenting. So the parenting approach in TFCBT is not necessarily unique. It can draw from a lot of the both positive parenting approaches like praise and one-on-one time, that other parent management training approaches may use, giving effective instructions, things like that, but could also include some behavior management. And in particular, having a trauma lens around helping caregivers understand not only appropriate developmental expectations for their children, but how those the behaviors and emotions that the children are exhibiting may be a result of their trauma exposure. And addressing things that may be common in the aftermath of trauma, like sleep problems that may be common, may be persistent. So those are just some examples of ways that these trauma treatment approaches could incorporate an understanding of psychological maltreatment as well, and support the parent in understanding the child's developmental needs, their need for support and positive attention, and to address some more maladaptive family dynamics and family interaction patterns that may be um, contributing to psychological maltreatment or exacerbating the child's difficulties as a result of their experiences. So with that being said, I want to shift a little bit to thinking about how do we prevent psychological maltreatment in the first place? How can we think about ways to keep children from having to have these experiences? And so some of that may be supporting caregivers in the ways that I've mentioned, building understanding of developmental expectations, building understanding of the negative impact that some of these approaches could have. And that's where raising awareness of psychological maltreatment can be really helpful for families so that they understand children's needs and also understand kind of where that line is of what's going too far. This may seem like a joke or a prank, but it could have harmful consequences. Um, it's also important to think about what are ways that we can support caregivers and support parents in more positive parenting approaches. How do we disseminate those more broadly so parents are aware of what they can do? I've had parents say, you know, I'm being told by CPS that I can't yell at my child or hit them, but what else is there? I don't know how to interact with my child. So the more we can support families in understanding developmentally appropriate parenting, the more I think we'll be able to prevent psychological maltreatment. And sometimes people do things in the context of stress and feeling overwhelmed that they may not intend to do. So, how do we reduce stress and support families more broadly? So, in conclusion, I will say that most interventions that are out there are not specifically designed or focused on child psychological maltreatment, but there are a lot of ways we can incorporate knowledge about psychological maltreatment into our treatment approaches. And I'm a big proponent of intervening as early as possible to support families in understanding each other, developing nonviolent conflict resolution skills, promoting positive communication, positive parenting approaches, because that can have really long lasting implications for development. And I mean, I will say as a parent, parenting is one of the most humbling experiences. Even with my training in child development, there still were stressful periods. So we know that caregivers and families need supports at many levels. So if we can think about how to build in those supports at all the different levels, community supports, larger system supports, and I think it is also sharing this information with child serving professionals to really highlight how understanding psychological maltreatment can help us all prevent and treat the phenomenon. So that being said, I think we have a few minutes. I see that there are some questions in the chat that have come up. And so Brittany, maybe you can help me kind of summarize some of the comments and questions that have come through in the remaining minutes that we have.
Absolutely. I first want to say thank you so much for, giving this presentation. It was amazing and very informative. One of the first questions that we do have, it kind of starts off as a comment, but then goes into a question. It says, I've seen some agencies advocating for CPS not to investigate child psychological maltreatment. Have you noticed any similar trends?
Well, I'm going to stop my share for a minute so that we can be able to have more of a conversation. It's always hard when I'm just talking out into the computer screen without the people here, but yeah, so one of the aspects of the work of the Psychological Maltreatment Alliance right now is, oh yeah, I can go back to the resource page. I'll share that again in a second. Um, so one of the challenges is that psychological maltreatment has not gotten the recognition that other forms of abuse and neglect have had. And so there are some real limitations in our state statutes for people being able to identify and then address the phenomenon. So trying to raise awareness and to think about I think there's also some emphasis as we've looked at child protective service systems and really trying to make some modifications in the way that those systems can support families. So maybe not so much in an adversarial context, but what can we do to support families so that it's not so much about um, accusations or getting into this adversarial approach. So I think that the more we can have all of our systems, including CPS, look at how can we provide families the resources and supports that they need to keep them out of the system. And so I'm seeing a comment about Missouri just passing some legislation that allows psychological abuse to be prosecuted. So it's trying to find the balance of, in some cases, for protecting the child, maybe there needs to be that prosecution or family court involvement. But I really try and think about things in terms of prevention and what can we do so that families don't have to be caught up in the systems in that way. But how can we keep families and children together? How can we reunify them as soon as possible? And to do that, it's really supporting those positive family interactions. Many families struggle with knowing how to do that and knowing how to support their children. And of course, we need to keep all of those perspectives in mind, the children's needs as well as the caregiver's needs. I do want to go back to my resource slide since that was requested. So on the resource slide, I just put the link to the SLEP Glazer and Manley publication. But also, if you look at the National Child Traumatic Stress Network website, there's a tremendous amount of information about different intervention approaches, as well as different forms of trauma. There is a website for child parent psychotherapy. .com, which can give you more information about that model. Most of the models do have their own website, so attachment and biobehavioral catch-up, you can find more information there, TFCBT and PCIT as well. And then we have a lot of fact sheets and informational resources on our Transform website as well, the transformcenter.org. So there is a lot of information out there, but families don't always have access or know how to access resources that might be available. There's not a coordinated system of care. We need to do a much better job with that in helping people understand children's needs and how best to support families in meeting those needs.
I think that's a great segue into one of the next questions that I see in the chat. So it says, since many states do not have strong definitions of psychological maltreatment and communities, parents, policymakers are not aware of the prevalence and impact of this form of maltreatment, how are parents identified and compelled to take part in these programs/interventions?
Mhm. Yeah, that's an interesting idea, thinking about how to compel parents. Because often parents, um, may not engage in services if they're feeling like somebody is forcing them into it. And I think it is important to elevate family voice and choice, to incorporate people with lived experiences into our approaches to supporting families, and into our treatment models. But often, the families that might sign up for programs are the ones that may have the least need for it. And that's sometimes the disconnect is, how do we help connect the families that need it the most? But it's also finding a goodness of fit, and it's in the approach. Because if I go in with a judgmental attitude and tell a parent how they should be raising their child, the chances of that actually working out as I intend are slim to nil. So that's where I really appreciate the child parent psychotherapy approach of engaging with families to understand their story and to understand what led them to the point where they are now, and to approach with more compassion and understanding as much as possible. But it's not an easy situation of finding ways of raising awareness of psychological maltreatment so that our systems, including our court systems, can really address it without having some of the language that's needed in the state statutes and without that recognition. And that is some of the work that the Psychological Maltreatment Alliance is doing now, is to work with those policymakers to say, how can we shape our policies in a way that can best support children and families? And what can we do to reform our approaches so that it's uh, keeping children safe while helping parents and caregivers understand children's needs and be able to respond to those. So I see a comment about breaking generational expectations and practices. Absolutely. And so, we're seeing more that's coming out now on people as adults reflecting back on their childhoods, saying that, maybe I experienced some things that my parent was struggling, and I wish things could have been done differently. I'm also seeing some comments about schools and teachers and other child serving professionals having awareness of these issues. Um, and so we just all need to continue to work together at the policy level, at the system level, as well as at the level of supporting each individual child and family.
I'm going through the chat. There's a lot of praises on how great this presentation was, and a lot of the clearly presented information. Um, if anybody, please feel free, if you have any other questions, please feel free to put them in the chat. There's a question that says, can we please have the references to the articles referred to in this excellent presentation?
Yep, I think what I will do, I will share a PDF of the slides. And I think I will expand a bit on the links to the resources, not only to have the websites for the different treatment models and things, but also to include some of the more specific research publications that I made reference to verbally as well. So I do appreciate everyone's time and attention during the webinar. It's always a challenge not to be able to speak with people more directly and see everyone's faces out there, but I do feel that this is an important topic, and I appreciate your willingness to work with me in raising awareness and sharing this information with your colleagues, and we will continue the work in the Psychological Maltreatment Alliance as well as the Fontana Center. So thanks so much for joining us today.
Absolutely. Thank you so much for spending the afternoon with us. Please feel free to visit us as the Psychological Maltreatment Alliance on our website, and have a great day. Thank you so much.
All right, take care, everybody.